So breast cancer is very common in our society. About 1 in 8 women in America will experience breast cancer at some point in their lifetime. So that's a pretty significant statistic. At this point, the last figures I saw were that over 3.5 million women in the United States are currently being treated for breast cancer or have completed treatment for breast cancer. So that's a pretty staggering number. And so it's definitely important to keep your breast health in mind and to take advantage of that preventative care measure by doing breast exams, getting mammography, making sure that your breast health is where it needs to be. Which is mammography, which most people know about. That is the #1 recommended screening tool for breast cancer detection. Screening starts at age 40. And women aged 40 to 44 can get mammograms annually if they're at a higher risk. Definitely after the age of 45, we recommend annual screening. After the age of 55, you can continue annually, or you can go to every other year as long as the mammograms have stayed stable. You continue until or as long as the patient is still in reasonably good health and life expectancy is 10 years or more is kind of where the cutoff is for that. Lastly, there's also breast MRIs that can be done. Those are not recommended for your average patient. Those are more exclusive for your high-risk patients. We kind of more so recommend what we call breast awareness. So it's important to be familiar with your own body. You need to know the quality of your breast tissue. How does it feel? What density is it? Those sorts of things. And so if you do happen to feel and notice something that is abnormal or irregular for you, it will prompt you to go and see your healthcare provider for it. Another type of breast exam that's done is the clinical breast exam. And that would be a breast exam done in the office by your healthcare provider. We usually do these as part of either your annual wellness exam or well woman check. That one also actually is no longer recommended by the American Cancer Society, but it's still commonly done in that type of setting. Lastly, there's also breast MRIs that can be done. Those are not recommended for your average patient. Those are more exclusive for your high-risk patients. So we're talking a woman who has strong family history of breast cancer, has had an abnormal mammogram previously, those sorts of risk factors.